Hello guys, so now we shall be discussing regarding the anatomy of your parotid gland. Anatomy of your parotid gland. So in this picture over here, where is the parotid gland guys? So this gland which you can see over here, right? So this gland over here is called as your parotid gland. Okay. Now if you very carefully look at this particular parotid gland, let me draw the border here. You see this particular gland over here is called as your parotid gland. Now if you look at what are the structures that are present superior, inferior and all, if you look here superiorly, if we discuss about the borders, of the parotid gland, superiorly what do you have? Where is your parotid gland located? See, isn't it located in front of your ear? In front of the ear, see, this is the place where your parotid gland is located. So superiorly in the sense on the top. On the top, what is this bone you have got? What is this bone? This bone is called as a zygomatic arch, right? So this is parotid gland where I am putting my 3 fingers is a parotid gland. Above I have got zygomatic arch. Below the parotid gland, what is this? This is called as the mandible, right? Below I have got mandible. On the back, what do I have? I have got my external ear. Okay, on the front, I will show it to you now. So superiorly, I have got zygomatic arch. Superiorly, I have got zygomatic arch. After that, inferiorly. Inferiorly, what do I have? Here, zygomatic arch is cut off, so you cannot see. And you cannot see the mandible also because that is also cut off. So, inferiorly, you have got the inferior border of mandible. Inferior border of your mandible. Okay. After superiorly and inferiorly, anteriorly, what do you have got? What do you have got anteriorly? Anteriorly, you see a muscle over here. You see this particular muscle, right? So this muscle which is located anteriorly is called as masseter muscle. This muscle is called as a masseter. See, this muscle is called as masseter muscle. Next, anteriorly is done. Next, posteriorly. Posteriorly, what do you have got? You have got posteriorly. Yes. What is this? External ear. External ear. And if you very closely look, posteriorly you have got external ear. Posteriorly you have also got this particular muscle. You know what is the name of this muscle? The name of this muscle is sternocleidomastoid muscle. Sternocleidomastoid muscle. So external ear plus sternocleidomastoid muscle. Both of them are located posteriorly. Okay. So I hope you understood what are the different borders. Now you should know that what is the use of this gland here, this salivary gland, which is also called as a parotid gland. It releases saliva, it secretes saliva. Now if it is secreting saliva, the saliva should enter into some duct, and where is the saliva secreted? It is located beneath your tongue. So the from this gland there must be some duct that is coming all the way and opening beneath your tongue and secreting the saliva there. Yes or no? Right. If you want, you can also let us say you can also test in this way that add few lemon drops on your tongue. The moment you add your lemon drops, you will have very severe pain in the parotid gland because the parotid gland will contract, squeeze to release the saliva and to dilute that. Okay. Right. Now what we shall do is that in this picture, first of all, let us discuss the structure of this picture, and then first of all I will tell you what is this picture, and then after that we shall discuss the parts over here. So in this picture, the first thing you can see over here is this one. So this particular structure which you can see is called as your parotid gland. Parotid gland. And next, this is your mandible. Cut section of your mandible. Attached to the mandible, what is the muscle you have got? Masseter. So this muscle is your masseter muscle. Okay, this muscle is your masseter. So anteriorly, what do I have? Masseter. So parotid gland is this. In front of parotid gland means anteriorly only. What do I have got? I have got masseter. Next, what is this? This is called as buccal fat pad. You see, you have got a fat pad over here. This is called as buccal fat pad. Okay. Just next here, this you see this green color line over here. This green color line is called as buccopharyngeal fascia. Buccopharyngeal fascia. Okay, above this buccopharyngeal fascia, or you can tell that this buccopharyngeal fascia is covering a muscle called as buccinator. Buccinator muscle. Okay, and so here let me draw one tooth over here. Okay, I don't know if it is, whatever it is. So what I am telling you is that this is the second upper molar. This is your second upper molar. So if I have to tell you one thing, that this particular gland is your parotid gland. Attached to this parotid gland, you see a duct here. This duct is called as parotid duct. Parotid duct. So what can you tell about this? What can you tell about this is that, see, let me describe this picture. First, parotid duct starts from the parotid gland. Okay, after starting from the parotid gland, this parotid duct moves lateral to the masseter muscle. Okay, it is moving lateral to the masseter muscle. Next, it is moving lateral to the masseter muscle. Then it is piercing your buccal fat pad. After that, it is piercing your buccopharyngeal fascia. It is also piercing your buccinator muscle, and then it is opening at the base of the second upper molar. So this is the pathway of this particular parotid duct. Okay. Now, if you look within the parotid gland, let us see what are the structures that are passing through this parotid gland. For example, what I will do is that, so this is your parotid gland. Let us say this is your parotid gland. Okay. Now, through this parotid gland, what are all the structures that are passing? For example, you see there is a structure that is passing through the parotid gland like this, right? So this structure which is directly piercing and passing through the parotid gland is called as fascial nerve. Now remember one thing, this is called as fascial nerve. Now remember one thing, as fascial nerve is passing through the parotid gland, you might think it might give some supply to the parotid gland, but no, it will not even give a single branch to the parotid gland. It is just passing through the parotid gland, that's it. Okay. Next, above, because of this fascial nerve, the parotid gland is divided into two regions. One is called as the superficial region, another one is called as the deep region. Above the parotid gland you have got is the superficial region, and below the parotid gland is called as the deep region. Okay. Now above this parotid gland we have got one more structure. We have got a vein here. Okay. So this vein which you can see over here is called as a retromandibular vein. This vein over here is called as your retromandibular vein. After this retromandibular vein, here also you have got one more artery, right? So this artery here is called as external carotid artery. Okay, so this is how the external carotid artery is. So this is your external carotid artery. And second important thing is that on the surface of this external carotid artery, you see a plexus like this. So this plexus which is present on the external carotid artery is called as the sympathetic plexus. So which means exactly here surrounding this external carotid artery, you see sympathetic plexus. So this one is your external carotid artery with sympathetic plexus. So if I ask you what are the structures that are located within the parotid gland, what are the structures will you tell? First important structure is your fascial nerve. Okay. Second important structure is your external carotid artery with sympathetic plexus. And third important thing is your retromandibular vein. Third important thing over here is your retromandibular vein. So these are the three important structures that are located over here. Okay. Next important thing is that what is the arterial supply? There should be some arteries, right? There should be some arteries which are supplying to your parotid gland. So there are two arteries. What are those two arteries? One artery is called as superficial temporal artery. superficial temporal artery. Another one is called as posterior auricular artery. Auricular artery. Where is superficial temporal? See, exactly here. Where is this? It is present behind the mandible, in front of the ear, right? So this artery is called as superficial temporal artery. If you want, you can put both of your fingers here, right? You can put the fingers here and you can very clearly palpate that artery. Next, posterior auricular is back of the ear. Back of the ear, the artery which you have is posterior auricular. And who is giving these two branches? Which artery is present within the parotid gland? External carotid artery. So the external carotid artery branches are two. One is called as the superficial temporal, another one is called as a posterior auricular. Clear? Next, if I ask you what is the vein that is present over here? What is the vein that is present over here? That is again the same answer, that is your retromandibular vein. Retromandibular vein. Okay. So these are all the important structures which you need to know regarding your parotid gland. Thank you so much for watching my video. Goodbye.